Performance Measures for ERCP and Endoscopic Ultrasound, a European Society of Gastrointestinal Endoscopy, ESGE, Quality Improvement Initiative. Introduction. The European Society of Gastrointestinal Endoscopy, ESGE, and United European Gastroenterology, UEG, have identified quality of endoscopy as a major priority. The rationale for this priority and the methodology of the quality initiative process have been described elsewhere. The aim of the ESGE Pancreatobiliary Endoscopy Working Group was to identify a list of key performance measures for EUS and ERCP that would be universally applicable. As with previous ESGE performance measures, the focus was on metrics that met the following requirements: proven impact on clinically relevant outcomes or quality of life, well-defined and amenable to simple and robust measurement, and applicability to all levels of endoscopy services. This paper describes the methodological process utilized and reports the agreed list of key performance measures for pancreatobiliary endoscopy. Methodology. The multi-step process of the methodology for developing performance measures has been described previously. During initial meetings of the working group, a PICO approach, where P stands for population or patient, I for intervention or indicator, C for comparator or control, and O for outcome, was used to define clinically relevant questions. Systematic literature searches were then performed by an expert team of methodologists. This in turn led to the development of performance measures in a consensus process. The PICOs and the clinical statements derived from these were modified or excluded during iterative rounds of discussion of the working group members during a Delphi process. In total, working group members participated in 2 rounds of voting to agree on performance measures in predefined domains and on their respective thresholds discussed below. Statements were modified during the process and ultimately discarded if agreement was not reached after 2 voting rounds. The agreement that is given for the different statements refers to the last voting round in the Delphi process. The threshold for agreement was set at 80% throughout the process. The key performance measures were distinguished from minor performance measures on the basis of the ISFU criteria: importance, scientific acceptability, feasibility, usability, and comparison with competing measures, and expressed by mean voting scores. The authors used the Grading of Recommendations Assessment, Development, and Evaluation (GRADE) system to assess the quality of the available evidence.